if you've never had yeast infection as a woman, you don't know what God has done for you, because it's one of the most common vaginal infection. Also, it is not an STI. It is not an STI, but it's one of the most common infection that you can get as a woman. And boy, when I tell you, it is the devil in disguise. Yeast infection will have you going mad, especially if you don't treat it early enough. Early detection is key in treating yeast infection, because not only are they very, very hard to treat, the chances of reoccurrence is also very high. Yeast infection usually occurs when there's an overgrowth of, let me just use simple terms, sugar in your vagina. Normally, your vagina is acidic. It's supposed to be acidic, but sometimes there's fluctuation, hormones, blah blah blah. So sometimes a lot of women do have yeast infection after their period or before their period. You know, this is the peak time that our hormones are upside down. So in most cases, when you develop yeast infection, you will know that you have yeast infection. You will know, because the discharge is very, very distinct. And one thing about yeast infection is there's no smell. It doesn't smell bad at all. In fact, you would not really know that you have an infection if not for the other signs that comes with having a yeast infection. So the discharge, it's usually like, you know, spoiled yogurt. That's the way spoiled yogurt looks like. That's how the discharge usually occurs. And then itching, you itch like you want to run mad. It's very, very, that's one of the distinct factor of yeast infection. The itching is very serious with yeast infection. And then there's redness. There's usually no abdominal cramping or any of that. It's easily treatable. You just need an antifungal. Over the counter self, you can treat yeast infection. You just need an antifungal medication that you can take in, and the one that you can maybe insert, or cream that you can use down there. But you cannot self-treat yourself. You can't self-medicate, because like I said, it has higher chances of recurrence. So you need proper guidelines, proper medication regime, so that you can treat it to the core. Not that you treat today and then tomorrow another yeast infection is back. I think I'm going to put a picture up on what yeast infection looks like.